Ready for medical career growth? Yes, you are in the right place. Hello, this is Dr. Neema Bish, BDS by degree and a pharma professional. As a founder of Career in Pharma, our mission is to guide medical professionals towards remarkable success in the pharma industry. With a track record of over 700 plus students trained and placed into various premier pharma companies, we are here to elevate your journey.
Hello everyone, once again I welcome you all to Career in Pharma and welcome to another episode of our important question answer series in pharmacovigilance. Now in today's video I am going to talk about what is case processing, which is very important interview questions, although this is something which you have to do in your job role when you are entering into pharmacovigilance at a fresher level. But still the basic steps you should be knowing, the idea behind case processing, why we are doing that you should be knowing. Yes, so let's begin with this video. Now what is case processing? First of all, what is case? Case means ICSR. I already explained in my past video what is ICSR, that is the individual case safety report in pharmacovigilance. Processing of these ICSR is known as case processing, and this process includes multiple steps. Yes. So at a very first step, I want to tell you that there will be different team members. Okay, this step of processing cases, which includes intake, quality review, medical review of the case. It involves different team members with different qualifications. So what all qualifications are eligible for these steps, that also I will be talking. But before I tell you those part, I will tell you what is case processing, what we do inside this. Yes. So like I said, ICSR case processing is known as, processing of ICSR cases is known as case processing. Now what are the steps in case processing? So first of all, we take the case, that is the case receipt. Okay, case receipt by any company is known as intake of the case. So first step is intake of these cases. Then once we have done the intake, when we have received the case, we acknowledge it, then we need to check the data inside that case. We need to verify the data. Once we verify the data, we need to check regarding the validity, if the case is valid or not, and if it's not valid, we have to push it into non-valid case workflow. If it is valid, it will go through all the workflow, like I already mentioned in the last video where I have explained what is valid case ICSR, right? So here we are checking with the validity so that accordingly we can act. Yes, because if you have to submit it to regulatory authority, there are different deadlines for different ICSR depending on their seriousness. So once we check with the validity, then we will do the booking of the case and registration of the case. Yes, and then once the case is booked, then we are going to do the data entry, and in that data entry we do coding of adverse events and drugs. Then there is a causality assessment, there is a expectedness assessment, then we have to write the case narrative, and then there will be a self quality check, and after that there will be a quality review step. Now at quality review steps, people who are sitting at quality review step, those people will be doing rechecking of the process of this case ICSR, which is processed by the case processor. So quality review step is very critical, where they need to check that everything has been done correctly till now. And once quality review is performed, after that comes medical review step. Yes, so medical review is where a medically qualified person, means doctors, MBBS doctors, they will be doing the review of the entire cases, and after medical review is done, after that the case will be submitted to the regulatory authority body. Now there is a little variation depending on which database you are using. The quality review step could be before or after medical review. Yes, so like in Argus, that is the Argus database, the medical review step is at the end. Okay, so if I talk in relation to Argus database, there all the steps remain the same, but there quality review will happen, then medical review will happen, and then medical reviewer will push the case to the regulatory authority. They will submit it to the regulatory authority. But in RSG database, what happens, medical review happens first, followed by quality review, and then quality review people will be submitted it to the regulatory authorities. Okay, so these are the steps in case processing. I will be explaining each and every step of this case processing in detail in this video, and followed by I also talk about what all qualifications are required, eligible, or have advantage over others. Yes, so let's begin with the steps of case processing. So first step is case receipt. Now inside case receipt there is a mailbox management where we have to check the number of the cases that have been assigned to us. So if any company is hiring you as a fresher inside pharmacovigilance, you could be at the intake step, you could be at the step where you will be doing triage of the cases, or you could be at the step where you will be processing the cases, or you could be at the step where you will be doing the quality review of the cases. Okay, so depending on for which step is company is hiring you, because at every step there will be different people, not a single person will be doing all the steps. Intake people will be different, triage people will be different, and then we have case processors, case processing different, then quality review, then medical review. Now why there are so many steps for the same case to go through? First of all, reason because every person, every step has their own part to do. Okay, so if anyone has to do intake, that person will do intake only. If anyone has to just triage the case, that person will just do the triage. Okay, so everyone has their separate step. And why there are so many steps? So that the case can be verified, the case can be checked again and again at every step to ensure quality, to ensure that whatever data we are giving to regulatory authority body is a good data, is a verified data, it is a valid data. Yes, so that's why so many steps are there. So depending on which step you are, you will be doing your role. Yes, so if you are into case receipt, yes, that we call as intake team also. If you are in that, there you have to do the mailbox management and you have to acknowledge. Okay, so inside mailbox management you need to check how many cases are coming daily, how many have assigned to you, and then you have to check the assigned cases, you have to identify those cases. Yes, and from the mailbox you have to select your cases, you have to check, and then you have to acknowledge. Okay, so once you get the case, you have to acknowledge. Okay, you have to acknowledge through mail that we have sent this report and now we are starting the intake with this case. So this is the mailbox management and acknowledgement of any case at the case intake step. Now second step is data verification and validity check. So this data verification and validity check is, it could be done by intake team only, or it could be done by the triage team also. Okay, now depending on the company structure, organization, a same person could be doing intake also, triage also, or there might be different steps. It all depends on the company, their project, number of cases they are doing in a day. Yes, so second step is data verification and validity check, where once the person who is sitting at the intake, they intake the case, they receive the case, they acknowledge, they will push it to data verification and validity team, where the people sitting at data verification and validity step, they're just going to verify the data and they look for the validity of the ICSR. They will check that the case, whatever the case receipt intake person has received, is valid or not, because accordingly they have to assign the priority to the cases. Okay, so that is triage step also. So in validity, after receiving the cases ICSR, they will check for the source document and they will check for the minimum criteria for calling any case as a valid case. So team sitting at data verification and validity check step will check that reporter is there, patient is there, identifiable reporter, identifiable patient, there is a suspected product and a suspected event, and once they confirm, they will push it to next step. Okay, either a valid workflow step, or they will just database the case in a non-valid workflow, where the non-valid case is not going to be submitted to the regulatory authority. So once they have confirmed that okay, the case is valid and it needs to be database, it needs to be pushed to other steps, then they will triage. Now what is triage? In triage they look for the priority depending on the seriousness of the cases. So if the case is non-serious, definitely the submissions are different, submission timelines are different, which I already discussed in my last video. If the serious, non-serious, depending on what is the adverse event, and based on that the timeline will be there. So after it's ensured that the case is valid, they need to do the triage, where they have to prioritize the case based on the receipt date, seriousness, causality and expectedness assessment. And once the case is triaged, then the cases can be processed as per the priority assigned to the cases. So for example, if any case processor getting 8 cases in a day to process, so again among this 8 cases also, as per the priority of that cases, like it's serious, what is the initial receipt date, they need to push the cases to the next workflow. So everything is priority based in pharmacovigilance. It's a timeline based work. Now once triage is also done, validity check is done, triage is done, then one more step is there which is very important, is duplicate search. So here the safety management team has to check that whether whatever case they have assigned is already there in the database before they move to the case processing. So with the help of safety management softwares, they will check, they will identify it's a duplicate or what, and they will perform the duplicate search. Okay, with the help of some characteristic like patient identifiers, patient gender, age, date of birth, or maybe clinical trial protocol number, or maybe with the help of country or any other reference number, they will do the duplicate check. Yes, so once data is verified, case is valid, and it is found that no other case is there, it's a new case, then the team will start with booking and registration of the case. So they will book the case, they will register the case, and once the duplicate search is finished, then let's say after positive duplicate search, means if they found that there is already a case in the database, then what they will do, then the case processor can add the provided information as a follow-up to the existing case. Okay, so they can process the information as a follow-up information. But if the duplicate search is negative, then in that case the case processor will create a new case to process the given information. So in short, I would say, if there is already an existing case in the database, then in that case whatever information is coming will be a follow-up to the existing information. If the duplicate search is negative, it means whatever information they are getting is a new information and they have to create a new case. Okay, so that is very important, duplicate search, because if we don't do proper duplicate search, in that case what will happen, the same case we are creating again and again, and we are submitting to the regulatory authority body the same case again and again, which will give over reporting of the same adverse event. Okay, so both the things are important. If you are not doing the proper duplicate search, if you are not able to find duplicate cases, it may lead to over reporting of the cases. If you are able to find, and in that case also you were not correct, then it could be under reporting also. So that's why duplicate search is a very critical step. Yes, so once we sure that case is valid, data is verified, and duplicate search also done, then the steps comes as a complete data entry. Now the complete data entry could be done by a data entry team exclusively, or there will be case processor that will be doing cases data entry as well, case processing as well. Again I am saying, depending on the company, their structure, there could be different steps for each and every steps. There could be different people doing, or the same people might be doing data entry also, case processing also. Now what we have to do in data entry, whatever there is available in the source document, like patient demographics, lab data, patient medical history, surgical history, drug history, and other details from the source document, we have to enter it into our database. That is called as complete data entry. Now many of you must be thinking, oh, this is data entry work, but now let me tell you, while doing data entry also, your expertise of understanding the documents will come into role. Your expertise of medical judgment, your expertise of your medical knowledge, clinical knowledge will come into role. For example, if there is any patient who had some surgery 30 or 40 years back, that is there in the document, but that surgery happened 30 and 40 years back, and it is not at all relevant to the current condition what is happening to the patient, or any adverse event happening to the patient today, right? So in that case you will skip that data and you will not enter that data into the database. So that's where your expertise comes into play. It is not that you have to do the data entry blindly as a layman. No, as per your medical expertise, your judgment, you have to do the data entry, right? Let's say any surgical history is there which is not relevant to the current context, so don't take that data. Yes, because it's not that you have to do all the entry of the data whatever is giving. No, you have to use your brains, you have to use your medical judgment. So it is very critical step, not just a data entry. Now once data entry is finished, then what will happen? The case processing team, case processor will code the adverse event. So whatever adverse event is reported in the report, the coding of that adverse event will also be done inside the database with the help of Medra dictionary. Now what is Medra dictionary? Will tell you in detail in different video. Okay, that is out of scope of this video because Medra is very important for interview and that needs a different video. Yeah. So with the help of Medra dictionary, the case processor will code the adverse event. Now this coding can be an auto coding. For example, when there will be exact match in the Medra dictionary, then it can be, it can be an auto coding, and it can be a manual coding if the exact term is not available. Then you have to rephrase the adverse event reported by the reporter. You just do the mix and match. Yes. So the principle behind the coding is to take the same language across all the countries, pharma companies and the regulatory authorities. They all should be on the same page with the help of this coding dictionaries. Now other than this, coding of drugs also happens. So if you have a company drug, in that case you will be coding with the help of CPD, that is company product dictionaries. So this company product dictionaries will be there inside the database. It all integrated. Medra, WHO, DD, CPD all will be integrated in the database only. Yes, and if there is no company product or maybe some other product apart from company drug you have to code, that you will code with the help of WHO drug dictionary. And you all know who gave WHO drug dictionary is WHO, right? Now once you code adverse event and drug, now the next step is you have to do the causality assessment. Now causality assessment, as you all already know, I already discussed in my past videos also. Causality assessment is the relationship between the suspected drug and the suspected reaction. So for the cases where the reporter is healthcare professionals and causality is provided, then we must mirror the causality as per the reporter because the reporter is already a doctor. But in case where the reporter is not a healthcare professional or the reporter is a consumer or relative of the patient and no causality is provided in the report, then in all those scenarios we have to assess the causality, and it must be provided independent causality irrespective of whatever is the reporter causality. So company will give you training on that also, what is their see, every company has different SOPs on causality assessment, different take on this. It can't be same, right? So depending on your company SOPs, company process, you have to assess the causality. Next step comes expectedness assessment, where to assess the expectedness, the case processor has to go through the reference safety information, RSI and other documents which the company will provide you. So whenever you are a part of a company, the company will provide you all the SOPs, all the reference documents which you have to refer while doing the processing of the cases or while doing any step inside pharmacovigilance. So you have to refer some documents for expectedness, like you have to refer reference safety documents, you have to refer CCDS, yes. So look for the expectedness, especially if a case processor is checking the expectedness at their level, they need to check all this document. And then comes the case narrative. Once all the data entry has been done, causality has assessed, expectedness has assessed, coding has completed, then there is a narrative. So in all the databases we have a feature of auto pulling the data, auto pulling the narrative. So whatever data entry you are doing, based on that your system will auto pull. So it's like automatic pulling of the narrative. But yes, you can't move this auto pull narrative to the next step, because there is always requirement of some editing and some changes in the narrative that you have to do manually once you auto pull the narrative. Yes, another step at at the case processing step is the self quality check. So once you are done with the narrative, again you will going to revise the case, that proper data entry is there, proper coding is there, other entries are fine, causality is fine, expectedness assessment is fine. And once you do quality check at your step, then you are going to promote or pushing the case to the next workflow, that is the quality review or the medical review, depending on the database what you are using. So at quality review step, now quality review person will not be doing data entry, okay. Quality review person will be reviewing the data entered by you at a case processing step, okay. So they will be doing the overview of the case. They will be going through the case properly once again, that everything has been done correctly till data entry. And once they are sure that okay, everything is fine, then they will push the case to next workflow, that is medical review, okay. Now at medical review step, medical reviewer guys have to check the narrative properly. Based on that, they have to check the causality assessment. They need to check that causality assessment has been done properly. They need to check that expectedness assessment has done properly. So there are few steps which are very crucial, few points very crucial for medical review is causality assessment you need to recheck, expected assessment you need to check, and definitely narrative. Yes, because narrative is very crucial. Once the regulatory authority is getting the cases, they can see the narrative only. Yeah, so narrative is very crucial. If you find that expectedness is not assessed properly at CP step, case processing step, or causality is not correct, you can ask them to just reassess it, and you can provide them your input, okay. So that is medical review step. And once everything is done correctly at medical review step also, then the medical reviewer will push and promote the case to the next step, where they are going to submit it to the regulatory authority. So this is the entire workflow, how it works. If you are going to join pharmacovigilance at a fresher level, you could be at any step, okay. Now depending on your qualification, see, if you are an MBBS guy, MBBS, MD, MS, whatever it is, basic MBBS qualification, then for you medical review step is the only step where you will be working, okay. So medical review will be done by medical reviewer always, that is MBBS people. Okay, now other than this, if you are a BDS, BAMS, BHMS, you could be at any step like intake, quality review, or data entry, or case processing. If you are a pharmacy graduate, life science graduate, in that case also you could be at any step. Yes, but in few companies they do hire dentist, BHMS, BAMS also as a medical review. Now what is the difference if they hire any MBBS as a medical reviewer versus you? The difference is the CTC which they are going to give any MBBS and the CTC which they are going to give you as a BDS or a alternate medicine graduate will be different. So you will be getting little less as a alternate medicine graduate or BDS compared to MBBS. Now what is the difference between life science graduates versus alternate medicine graduate in the case processing, intake, and other steps, okay, of case processing? Difference is there are few companies who don't hire life science graduates for this steps. Reason is definitely as compared to life science graduate, the alternate medicine graduate will definitely have a better understanding of medical concept, better clinical knowledge, and which will create a difference while assessing the reports, okay. So for example, if you are a life science graduate where you don't know what is pharmacology, you don't know the concept of drug and disease, then definitely the report which you go through versus the report which any alternate medicine graduate will go through will vary, okay. Your way of processing the case will be vary. Your judgment in in deciding which data to take, which not will vary. Yes, so few companies do prefer alternate medicine graduates for CP intake steps, trial steps, but yes, there are few companies who do take life science graduates also. So yes, that is all about pharmacovigilance case processing. I hope you got a clear cut idea on this, and I get lot of time many questions that what actually I will be doing when I get a job in pharmacovigilance at a fresher level. Then let me tell you, this actually you will be doing what I just explained you, that is the case processing inside pharmacovigilance. Yes, and I hope it is clear for MBBS graduates also, life science graduates also, and alternate medicine graduates and dentists also. Yes, so that's about this video. If you still have any doubt, if you still have any confusion, please feel free to ask your question and doubt below in the comment box, and I would love to read all the comments and would love to reply each and every comment from you. Yes, and if you want any topic us to make video on any part of case processing, whatever it is, please comment so that we can do the same for you. Yes, so that's all about case processing in pharmacovigilance, and I hope you got clarity what actually you have to do work when you got a job, when you get a job in pharmacovigilance. Yes, so that's all. We'll be coming soon with some fresh next video. Till the time I come again, till that time, please stay safe, aware, healthy and updated, and keep exploring new things. And please don't forget to subscribe to our channel, don't forget to hit a like button, and don't forget to share it with your friends. And by doing so, you can help them also in clearing the interview. So that's all for this video. We'll come soon. Have a nice day. Bye bye.